Hi, my name is Greg. Last time I asked you to ask some questions about our devices and we get some, so today we decided to answer the basic questions like what probes to use in a small animal clinic and how to adjust the device, and later on we will answer the question about the repro scanning in a dogs. As for adjustments of the ultrasound scanner, right here we are performing the ultrasound examination of a dog. She's a female, and here, for example, we are at the level of the urinary bladder. First, what we adjust is the gain 1 and gain 2. So the gain 1 is making brighter or darker the whole screen in ultrasound, and gain 2 is the far field gain, so it makes brighter only the far field in the ultrasound image. So here, for example, I would like to assess the urinary bladder, and I decrease the gain a little bit. Okay. And now, for example, when I want to see something below urinary bladder, I should adjust the depth of scanning. So I increase the depth of scanning, and here I'm looking for the uterus. It's here on the image, this hypoechoic structure. Okay, what is important when I'm focusing on some region here is to remember to put the focus level on the level of the structure that I'm looking at. So right now we are adjusting the focus. You can do it by hand or pushing the buttons. And once again we are watching the uterus here. I will increase the gain a little bit. Here we have this structure on the longitudinal section under the urinary bladder. And if you would like to get the most the best image quality, we should remember to adjust the frequency, and remember about the rule that the higher the frequency, the better resolution, and the lower the frequency, the resolution is decreasing a little bit. So as we are able to reach the structure with the high frequency, we should keep it the highest possible. And in Forvet Slim, the basic settings we can adjust by moving the finger in the active field. So this is how I change the focus position. This is how I change the gain 1, and here I can change gain 2. On the right side of the screen I'm changing the depth of scanning. Okay, right now I will show you how to measure some structures on ultrasound image. For example, we can measure the wall of the urinary bladder. Here we can see the very thin 2 hyperechoic layers of the urinary bladder wall. Oh, right now she's dancing. Yep. If I want to measure something very small, I just press and hold the finger on the screen, and this is it. This is 1.5 millimeters, so very good. Let's go for the kidney. So again, we should do same things that we did with the urinary bladder, so we should remember about adjusting the brightness of the screen so we can see the kidney appearing here. We should remember about focus, about the frequency and the depth of scanning. And right now the kidney is about 2/3 of the window of the ultrasound scanner, so we can see the structure of the kidney and we can see what is around. This is the cross section. If we would like to change the gray map, so make it a little bit softer, we can use the gamma setting, and now the image is a little bit more grayish. If we would like to add some contrast as well, we can do the same with the gamma setting and then increase or decrease the gains. Okay, it looks nice. To save the image with the measurement, we just tap freeze, measure, and then save image. We can put here some details of our patient, and that's it. You also asked me about which probes to use in the small animal clinic. The standard probe is microconvex, and I think that about 80% of your patients can be examined with this probe. But if you want to see some more details in the near field, or we have a lot of small patients like Yorkshire Terriers or cats, we should think about having an abdominal linear probe, higher frequency. This one is 10 MHz. So I will show you how it looks, how the image looks like from this probe. Okay, when you change the probes, it should be recognized automatically, and that's it. It's here. So you can easily see that the image is a little bit bigger, but here what we can see is just 6 centimeters. And here we can see the details of the wall of the small intestine. So we can see the lumen and all the other layers of the wall. This probe is basically used for the smaller animals. Here is the kidney that we watched before, and this is the maximum depth of what we can get. But the details of the kidney are better visualized on the image right now. Let's go for the uterus. And here we can see also the uterus and its structure. Yep, here. And this is it. If you have any more questions, just feel free to ask. Thank you.